If you don't take time out for your wellness, you will be forced to make time out for your illness. Welcome to Aware and Care, a series, an Ayurvedic series of taking care of your health with me, Madhvi Battula, and Dr. Ambika Nair, who is the co-founder and chief consultant at Santhigram Group of Companies. Welcome to the show, Dr. Nair. Namaskaram.
Namaskaram. How are you?
All very good, Dr. Nair. We've been getting wonderful feedback and questions from our viewers, and picking one from them today, we're going to discuss that. There are certain
Okay.
symptoms which we often talk about, that is about painful urination, incomplete emptying of the bladder, pain in the back,
Okay.
and
Okay.
people sometimes think it is diabetes or UTI. In the series of men's health, today we want to talk about prostate care and enlargement of prostate. This is a question from one of our viewers. We want to discuss
Oh,
this topic and help them to heal and feel better.
okay. That's very good actually. They started giving us, like very good subjects. Okay.
Mhm.
It's a very good subject actually
Mhm.
because, like it is called benign prostatic hyperplasia or
Uh-huh.
hypertrophy.
Okay.
It is the non-cancerous growth of the prostate gland.
Mhm.
There will be changes in the, like it is a non-malignant proliferation of the epithelial and the stromal cells of the prostate gland actually.
Uh-huh.
Okay, because of the pressure and any growth is there, so the changes comes out there. Not
Uh-huh.
only that, it can be seen, from the age of 40. Even I have seen cases like a 32, 33 and all.
Mhm. So
So
this is a myth that it is only age related. It can start early too.
it can start early because like nowadays stress is too much.
Okay.
So, like the testosterone level comes down also because this can happen.
Mm-hmm.
And because of the overuse of all these drugs these days,
Mm-hmm.
it's very common these days.
Okay. So I
Children
mentioned
will
a
come.
couple of symptoms. Are there any more symptoms that you would want to add, which is part of
So many
enlarged BPH?
symptoms are too many. Like obstructive symptoms will be there. That will
Mm-hmm.
be the person will have hesitance. See, he will have the urge, but he cannot go.
Uh-huh.
And some people will have so much of painful
Okay.
urination
Uh-huh.
because that itself, because actually it does not come because of the obstruction.
Mm-hmm.
So that's the way, that we diagnose how, we ask them questions, when anybody comes to the clinic, we will be asking them
Mm-hmm.
after passing urine, you feel like going again,
Mm-hmm.
how much urine comes, whether the
Mm-hmm.
whole flow is consistent, whether
Mm-hmm.
any intermittence in the flow,
Mm-hmm.
whether, like the stream
Mm-hmm.
has to be in a continuous stream, because
Okay.
some days it will be very thin. They will tell that, the stream is very thin and
Mm-hmm.
it takes like time for me to pass urine.
Got
So
it.
these all because there is an obstruction over there.
Mm-hmm.
Okay. So, like any, I told you about the growth and all.
Right. So,
Okay.
Doctor,
So
see, the symptoms that you're mentioning, I think we've also discussed this before some time, that it looks as very similar to UTI or kidney stones. So there is always a misdiagnosis which happens. But when you talk about men's health, I think this is where the diagnosis or the treatment starts from first checking on those particular aspects of it. Do some people also experience blood in the urine?
blood in the urine means at that time we can suspect there is kidney stone.
Okay.
Okay, because here, because sometimes, because if they strain for a long time, if any malignancy is there, like any benign growth is there, any tumor is there, or
Mm-hmm.
any rupture in the
Mm-hmm.
urethra, then only, like a little bit of stain in the urine will come with
Okay.
the blood. Otherwise, it will not be there. Because sometimes
So,
it can be even prostatitis also.
uh,
Sometimes it will not be any BPH, but just an inflammation. Some pelvic inflammation also it can happen because of that. Yeah.
So what is the timeline for somebody to actually see that this is something very serious? Usually people start drinking lots of water. And what is the state of mind for somebody who is going through BPH?
See, like this first I told about the obstructive symptoms.
Uh-huh.
Now like you should have like irritation
Mm-hmm.
because dysuria.
Mm-hmm.
One part want to pass urine, but it will not come.
Okay.
The
So,
urge is too much.
So
but
this
he cannot
particular
go.
problem, BPH, does it come naturally because of age, or are there any underlying conditions the person should check before coming to the doctor?
Actually, like because this is a very good question actually, because children, like even they're 25, 26, 27 and all, they come to
Okay.
this such complaints because they will treat themselves first. When they cannot do it only, then they will come to, they will they tell some doctors, or they will tell their parents, because
Mm-hmm.
actually, see, too much indulging in sex,
Mm-hmm.
drug addiction,
Mm-hmm.
stress, diabetic, lack of sleep,
Mm-hmm.
controlling the urge for urination for a long time,
Mm-hmm.
even defecation. All
Okay.
those things should not be done actually. They will,
What
like
what about tight clothes? Does it also affect?
very tight clothes does not, like too much, but very
Uh,
skinny, like no freedom at all for anything. That also. That's why we always tell, to sleep without, like wearing any underclothes at night.
okay.
Try to wear loose clothes, so that every organ in the body can, breathe.
Okay.
Yeah.
So this is so. What about drinking water? Most people usually feel that when the urination is not the flow is not good, people tend to drink lots of water. Do you recommend? And in fact, when you're talking about men, most men also get indulge in hard drinks and assume that beer also could help them to increase the flow of the urine. Is it true?
No, English, see, any obstruction is there means the flow will not be there. If the
Okay.
dysuria is there, we have to rule
Hmm.
out what
Hmm.
type of prostate he is having. Whether, like, because if any, like, so many obstruction means we have to see his PSA, whether he is having any cancer issues,
Okay.
anything like that. Sometimes any tumor will be there, the prostate, because it is located under the umbilicus. You understand? No? So
Okay.
that is,
Hmm.
like under the nabi. So it is a
Okay.
hard gland.
Hmm.
Already it is little bit hard,
Hmm.
and like because it moves
Okay.
the space
And
also.
does this also affect their sexual health, the erectile dysfunction?
Yeah,
Is that
coming
also
to
part of
that,
it?
because their libido will come down a lot
Okay.
because the testosterone level is low.
Hmm.
So naturally it will affect their libido, and
Okay.
that itself is make another depression in them.
Oh,
So then, online you can see so many medicines for the libido they will take, but they will never get treated for their prostate,
okay. So
because
on a
people think,
on a general rule of thumb, how many times a year, or what is the annual checkup that men should definitely follow?
no, after 40, like they go for the PSA, and they
Uh,
we see if they find any problem like that, especially the other checkup, they will always see the ultrasound will show, and the rectal examination. If anybody will complain of that, then the rectal examination they will tell that whether you have any hypertrophy. Okay, then, like because it's not a must for everybody to go for a, like a surgery.
okay.
Okay, some people will have so much of urinary infection.
Okay.
Okay, then, like that inflammation has to be controlled. That's what I told. Whether it is kapha related, mostly it will be kapha related, because they will have like a fat under the, like abdomen,
Uh-huh.
because that is the place where the apana vayu is there.
Okay.
Okay, in Ayurveda we call it as apana vayu dosha, because actually that is capsized over there. It's
Okay.
not no movement.
Uh-huh.
We
So
need that vayu for our defecation, for the urination, even for the natural childbirth also we need it.
we need that, right?
Yeah,
So the question definitely has come to a right point where we're talking about childbirth. Does this also affect fertility before we go to the treatment and other aspects? When
definitely.
does it affects?
Yeah,
Okay.
because actually the blockage, sometimes it will come on the vas defense. So
Uh-huh.
there, like there, when you go for their sperm count, you can see there
Hmm.
is no sperm count, even azoosperma, because we get a lot of cases like for the infertility also. That's what
Hmm.
I'm talking like this. Okay, but like it's very like easy also to diagnose, but to convince them they will be fine, and they show very good improvement very fast actually,
Yeah.
and people accept it. Oh, it is a, oh, after 50 and all we will have these issues. They
Okay.
accept like that actually. That is
Hmm.
also, like an epidemic. Oh no, we have to live with this.
Okay.
So from 40
So,
years it will be like 20%. By the age
so,
of 60, like 80%.
mhm. So when you're talking about all these symptoms, I know we've come to an era and point where people also have asymptomatic situations. So is there an
Yes.
asymptomatic prostate enlargement also?
Yeah, because some people will not show any symptom at all.
Okay.
Okay, but when they will go, because that is, like in old people, when you go for that, they will see that, but like they will experience constipation a lot.
Okay.
Some people will have very chronic constipation.
Okay.
We will ask them, how is the urination? Everything is perfect.
Mhm.
So when they go, when we ask about the constipation, then we tell them, okay, go for the like the test and all. They will tell that you were right, because actually my like prostate glands were enlarged.
Mhm.
So once you treat for that, then they will fall, like fall into place, like proper.
So I know we come to a point where we ask this question whether it's preventable or curable, but let's start first with is this preventable? Because at an early age, if there's something that boys can do, parents could inculcate those food habits or certain things which can prevent this, or it is
It is preventable.
it is
It
preventable.
can
So
be
what?
taken care. If you
Mhm.
really take care of that, like because the whole unwholesome food, what you eat, you should have a regime in your life.
Mm.
Too much of drinking, too much of smoking, not
Uh-huh.
taking care of you. See, because actually there are two ways: one to live with the diseases, one to live without diseases.
Right.
Option is yours. You are your
Mhm.
own judge.
So a person with enlarged prostate comes to Santhigram. So what is the process which he has to go through? Does he have to go through any blood test or physical examination, or it is just through Nadi Pariksha?
Actually, physical examination is also done
Uh-huh.
if needed. Otherwise, through the pulse, we always see that how much even their post-viral urine is there.
Mm-hmm.
Even after passing urine, how much is left in the bladder. That itself,
Mm-hmm.
we know it.
Mm-hmm.
Okay, that is a very good way of like diagnosing through the pulse actually.
Mm-hmm.
Whether the patient has any backache, any
Mm-hmm.
constipation, whether he has any pain in the thighs,
Okay.
even lower abdomen, because the upper body, if it is capsized, you will have all these symptoms. Whether his sleep is better,
Uh-huh.
whether this fellow has any pain on his breast, whether any enlargement in the glands,
Uh-huh.
all these things we'll see. Whether
Okay.
he snores a lot, whether he's obese,
Mm-hmm.
okay, all these things, cholesterol, everything we had to see.
So complete wellness checkup is done, and
Yeah,
then the
then only
aspect of
we start doing the treatment actually. We have
okay.
like a very good treatments also for this.
Uh-huh.
Yeah.
So I am assuming that this is curable, not only manageable, but it is curable.
It is curable. Some people
Okay.
with when they come, like they have like a PSA on the high PSA also, when we do the Panchakarma therapies.
Uh-huh.
So when they go for again for their checkup, their PSA is very low.
Uh-huh.
Some we will advise also, because actually when it is cancerous, we don't allow them to be with us. We
Okay.
tell that because it is stage, say, second stage, you go for the surgery and come
Mhm.
back, like then there are so many cases like that.
Okay. So
Yeah.
in a non-cancerous form of BPH, many a times they are recommended surgery. Correct me if I'm wrong. So when a patient goes for surgery and then realizes it is a mistake, and then they come back to maybe the herbal form of treatment or through Ayurveda, what is your talk with them? What
So
happens at
my
that point?
goodness, actually it's a very good question you ask. I get a lot of cases like that. But nowadays, Madhavi, there are awareness for this. Okay, so like even in the Google, they will see that.
Mm-hmm.
So like so nobody like not like before people opt for surgeries.
Mm-hmm.
So they always try the herbal supplements
Mm-hmm.
and their yoga,
Mm-hmm.
everything. Then they feel better and they continue, and the symptoms will definitely come back.
So they do come back. So if
Yeah.
let's assume a little case study here that somebody has had prostate surgery done many years ago, but the symptoms have again come back. So that also curable or manageable?
Symptoms comes back means they will have some other inflammation.
Okay.
You understand? Not only like the prostate is not there, so
Mm-hmm.
BPH, but the complications, I have seen a lot of complications. Their libido is not there. They get frustrated.
Mm-hmm.
Like that is there. See, men, they feel that they are not wanted then.
Mm-hmm.
So that is also another problem. They get depressed a lot.
Okay.
Yeah.
So these are the factors that you consider. Are massages or other kind of treatments also recommended for
Yeah,
somebody
Panchakarma,
suffering?
when we do the Abhyanga, then we
Okay.
do the, yeah, that because I told you sometimes, Uddhavardhana is given, especially
Uh-huh.
to reduce the fat over there. See,
Uh-huh.
it is seen in, some people take a lot of fat. Okay,
Okay.
that is cheese also. They overindulge in taking cheese. So
Okay.
these, like these all, because such people also, because they get prostate a lot.
Okay.
Here, as if it is very common, they will tell like nowadays it's very common, not only here. They will
Mm-hmm.
tell that if we take the Euroflow or anything like that.
Mm-hmm.
Yeah, so many people come to us. Some people cannot control the urination,
Mm-hmm.
incontinence is there. If they take the such, even after surgery, people come and tell me, I cannot control my urination.
Okay.
Yeah.
So there is a combination of things which are happening when an enlarged prostate. You also mentioned about libido a couple of times here, and also the physical discomfort of incontinence and lack of complete urination. Now there is a psychological impact here. A person who comes there for treatment, what is his priority? Whether he is looking for the treatment for the libido. Most people think that that is one of the problems, and sometimes they think diabetes is the problem. Sometimes they think that it's only the prostate. So
They will,
how do you deal
they
with it?
will, yeah, they will come and write ED, erectile
Okay.
dysfunction.
Okay.
Okay, then like we'll ask. There are certain questions, we had to ask them.
Uh-huh.
So because before, I used when I started practicing, I used to think that they may not be open. So, but
Okay.
maybe they feel comfortable to ask me anything.
Hmm.
Ask.
So
This is my
in
profession.
cases such like that, do you recommend the partners also to come for the treatment and have understand what's happening and what the
Counseling,
support function has to
counseling
be?
is done. Counseling is
Counseling.
done with that.
Mm-hmm.
Actually, normally with the family only they will come.
Mm-hmm.
Okay, normally they come like that, but some
Okay.
people come alone also. So if
Mm-hmm.
any problem, like they will discuss because that this is all personal things. So
Absolutely.
even I can also go to a gynecologist. Okay, right, the same way. So
Uh-huh.
they feel comfortable and they know that the herbal medicines will not, like they can take for a long time without any complications. So
Uh-huh.
they like to take it also.
Okay. And what kind of food support the health of a prostate?
That's a good question actually. Okay, wholesome food has to be taken.
Mm-hmm.
Okay, like here people like because of working people are more, so they will be eating all whatever is available.
Mm-hmm.
So we tell them what because it all depends upon the type of the body.
Okay.
Okay, we cannot, like food is okay. Only thing we tell them, otherwise their sleep will be disturbed. Sometimes they feel like take, like going to bathroom a lot of time, and
Mm-hmm.
then it takes a lot of time also to urinate.
Mm-hmm.
Yeah.
So, a young man or an aged man who comes with enlarged prostate, his treatment has started at Santhigram. Is a diet that you're informing, and a man is a social animal, and we have a lot of social events happening where social drinking is possible. Not that everybody drinks; it's a personal choice. There is smoking, which happens again, a personal choice. Vegetarian, non-vegetarian is a personal choice again. But when somebody is going through a treatment, is there something that you would say that this has to be restricted, or it's okay to have continue?
No, actually, during the Panchakarma, it is a detoxification,
Mm-hmm.
mentally and physically. At that time, we don't allow them to do any non-veg.
Okay.
Okay, so like every cell in the body will be cleaned. I
Mm-hmm.
can regenerate and give them back,
Okay.
and they feel it also.
Mm-hmm.
Only during the Panchakarma, and we tell them, like if they can, because it's here it is little difficult, but like people understand it. They will tell that like I don't have any issue like that. Okay, even after 3 weeks of treatment, again 3 weeks they will continue. Some people like afterwards. They will tell
Okay.
that because when I stopped, like all the non-veg, now I feel so good with the vegetarian cooked food.
Mhm. And during the treatment, are there any restrictions on sexual activity too?
Yeah, sexual activity will be totally curtailed at that time. We don't allow them to do it.
Okay.
Because actually that is already in Panchakarma, you are losing the energy, then only you regain. At
Uh-huh.
that time, we don't allow them. That is already because we always explain everything to them.
Okay. So these are some very interesting and informative session that we've had. We're talking about prostate enlargement and curtailing that, curing that, preventing that. Now, what is your message for parents or family members who are taking care of young boys? And of course, as they're growing, they may also lead to this particular situation. Is there something that they can start doing from a younger age to see that this is
Yeah.
preventable, and any kind of exercise or food that has to go into the daily diet?
Madhavi, I get, like I have treated actually children, like 24, 25, because when they are like the age group of like thinking of getting married, like 26, 27. So,
Uh-huh.
the mother brought the child to me by
Mhm.
telling that because he has the erectile dysfunction.
Okay.
Okay, so his testosterone level, because you have to do the, blood work for that actually. His testosterone level was very low.
Mhm.
Then we have to do certain therapies in Ayurveda, but he is doing very well actually.
Fantastic. Okay.
Okay,
That's nice to know.
there are very good
Mhm.
treatments. And see, one of the things people should notice that if your son is going like frequently for the urination,
Mhm.
if he is not revealing the truth to you,
Okay.
or even yourself, like anybody, like after 40 years or 42 years, if you have a like a situation like this,
Mhm.
little bit of low backache, frequency in urination, any pain on the thighs and all, and on
Mhm.
the calves also, please see that there is something wrong. I'm not telling you have like BPH, but
Mhm.
there will be something, instead of destroying your like your life. So if you take care in time, that that will be very fruitful for you.
Absolutely. And what about physical activity, exercises, and going to the gym? Is this restricted or they can continue to do so
No, during the
with the treatment?
Panchakarma, we don't allow.
Hmm.
Once they start taking the treatment, because they will be able to hold the urine for a long time, they will come back to the normal life actually.
So,
Because the first itself, like after 1 week itself, they will tell that the frequency has reduced, the
mhm.
flow is becoming better. So
Okay.
this all they will tell.
Okay.
They
That sounds
themselves will
very
tell.
hopeful and positive. So, Dr. Nair, is there anything that we missed out that you want to convey to our viewers about prostate
Yeah.
enlargement, the
Yes.
Ayurvedic treatment?
I see Ayurvedic treatment, anybody can come, they are most welcome. But
Hmm.
what tips they should follow is that if you are traveling for a long time, also don't be lazy. Please get up and go for urination. Don't keep it for a long time.
Hmm.
And your defecation also, you have to go. So don't keep it and try to sleep
Regularity is a
properly.
must there.
But
Regularity is a must. So they should be regular
regularity is
as
a
well as
hundred
when they do
percent
should not
must.
control it.
Yes. Because people are lazy, they are in the computer, they will not get up, Madhavi. That is one of the things. Okay, this like you see, movie theater also they will give interval, but here people doesn't want to go. Okay, and
Very
if you
interesting.
have a problem like this, don't drink so much of water before you sleep.
Okay. Those are some very important points that you have mentioned.
Yeah.
And we always saw that it was women who were always hesitant to use the restroom, but I think men also do that. And today it's not only because of any social factors, it's because the work culture is such and every minute matters and people are not taking care of their health. And that's the reason this program, Aware and Care, is brought to you so that we talk about everything that concerns the body, your mental well-being, your physical well-being. So if you have any questions for Dr. Ambika Nair, feel free to put them in the comment section or call your office and we would take up the topic and share it with all our viewers. Dr. Ambika Nair, thank you so much for this show. But if there's anything, then a final parting word that you want to share with our viewers, we appreciate that.
Yeah, they should drink a lot of water, like not very cold water. They should, stay away from that actually.
Hmm.
Try to drink little bit of lukewarm water. That is more important actually.
Okay.
Okay, especially when you get up in the morning, if you drink like 2, 3 glasses of water, that
Uh-huh.
will really make your life wonderful.
And I guess that applies universally. Thank you so much, Dr. Ambika Nair. It is always a delight to be talking to you and learning so much about this body, which is a mystery, a miracle, and of course, a boon. Thank you. And I look forward to our next episode with you. Namaskar.
Thank you, Madhavi. Thanks a lot.